Hello guys, welcome back to another video. In today's video we are going to see some of the reason why you should do pregnancy scan at an early stage. And if you have not subscribed to this channel, kindly do so. Like my video, share, comment. Let me know what you want me to talk about in the next video. So these are some of the reasons why you should do ultrasound at an early weeks. Usually, sometimes it is recommended to do an ultrasound from 6 weeks to 16 to 18 weeks. Before 6 weeks, it is also not recommended because the fetus has not developed some of the organs and some of the parts that can make the scan, that can give some of the information that will help the doctor to diagnose or to identify the problem. So these are some of the reasons why you should do pregnancy scan at an early stage. Number one, it will help you to confirm the pregnancy. It will help you to verify if that pregnancy is there. Sometimes you have seen that there are several cases where somebody is pregnant and when sent for urinalysis to do a pregnancy test, the pregnancy turns negative because of some of the reason that they know. They don't want us to know. And if you confirm the pregnancy from 6 weeks with an ultrasound, it will really verify that that pregnancy is there. Number two, it will show if your pregnancy is regular or an ectopic pregnancy has occurred. Ectopic pregnancy is where the egg was fertilized outside the uterus. I mean, the egg was fertilized and start implanted outside the uterus. You know, after fertilization, the fertilized egg should transfer or should move to the uterus so that it can be implanted there, and then it start growing from there. And if it does not happen like that, an ectopic pregnancy will occur. So ultrasound will identify if ectopic pregnancy has occurred or if your pregnancy is normal. And if ectopic pregnancy has occurred, you know, ectopic pregnancy has some of the risk, or it can cause a lot of dangers, or maybe it is an ectopic pregnancy is an emergency case. So to prevent this, you should do an ultrasound at an early stage so that you identify if you have an ectopic pregnancy, and then correct intervention will be taken at the right time. The third point, it can ascertain if you are having a single pregnancy, twin pregnancy, triplet, or more. If you have an ultrasound at an early stage, I'm not saying if you are having, if you've done an ultrasound at third trimester, you can not identify if you have a twin pregnancy, but it will ascertain at an early stage that you are carrying more than one pregnancy, and therefore a lot of intervention will be put in place, a lot of care, prevention will be put in place, and then we will deliver triplets or twins that are healthy. You know, sometimes we identify that you are having multiple pregnancy at when the pregnancy has grown, and maybe some of the care were not taken, and therefore maybe some of the complication may set in if those care were not implemented at an early stage. Yeah. So the next point, it can also help you to identify the gender of the baby that you are carrying. Usually when you go for ultrasound at later days or when you are in third trimester, you will not be able to know sometimes the gender, because the baby has already entered into the pelvic and it has already assumed that position that the baby has already assumed the position and is ready to be delivered, that position that the baby usually assume ready to be delivered. And therefore you get that the getting the private part of the baby when the baby is in that position sometimes is hard. So it is always advisable you go for an ultrasound to know the gender of the baby you are carrying at an early stage when the baby has not entered into the pelvic prim. The next point is that when you go for an ultrasound when you are in the third trimester, the expected date of delivery will differ with the expected date that was calculated when you were going for your antenatal clinic. And this is the reason why. This is because you see, when they do an ultrasound when the pregnancy is still young, you will usually get the correct expected date of delivery, and this date will not differ from the expected date of delivery that we usually calculate during the antenatal visit. So I think those are most reasons that you are supposed to go for an ultrasound at an early stage, so that you don't accuse those who are doing those who are, so that you don't accuse those who are taking care of you for giving you false information. So thank you for watching this video. Let's meet in my next video.